Hi, welcome to the Mansfield Public Schools Health Services Reopening Update. I am going to get started here. Okay, sorry, just a few technical difficulties. I'm Christine Dooling. I'm the Director of Health Services, and I will be reviewing some changes to the Health Services Protocol and some changes to the Mansfield Public Schools that will be instituted in the school year 2021 due to the COVID pandemic. Also on the live stream tonight is Teresa Murphy, Superintendent of Schools. We also have Chief Justin DeRosier, who is from the Mansfield Fire Department, and Betsy Savoy is the nurse from Mansfield High School, and she will be offline manning the questions, and we'll have some pauses in the presentation to answer group questions. To start with, I'm going to go through the agenda for tonight. We're going to talk about some health promotion strategies. We're also going to go through the student daily self-symptom screening checklist that all parents will be receiving before school. We'll talk about the new flu mandate that just came out a few days ago, modifications to our health offices that were made over the summer. We'll talk about the respiratory protection room that will be in place for students who come to us with respiratory symptoms. We'll review some graphs for key actions for COVID-19 events that may happen in the school, and we'll just talk about a little bit of the difference between isolation and quarantine. And at any time when we get to the later slides, I will bring in Chief DeRosier to talk and help us with support. So first of all, I'm going to talk about some health promotion strategies in the school. Like I said, we're all going to have student and staff will be doing a daily self-symptom screening checklist, which is very important for every day to go through the checklist and to see how you're feeling and if you're well enough to go to school. Oftentimes, kids go to school when they're not feeling well, staff goes to school when they're not feeling well, and this school year we're really needing to take our health and safety seriously, and when you aren't feeling well, that's when you take your sick day, and that's when you stay home. We'll go through the checklist in a minute. Mask and face coverings. So employees will be wearing masks in the school. They'll be wearing cloth face coverings or surgical masks that we will have for employees. We will be going over proper hand hygiene frequently with students, and we will be talking about proper respiratory hygiene, coughing and sneezing into tissues in your sleeve and washing your hands afterwards. We will be practicing physical distancing throughout the school year. We will be keeping students 6 feet apart. We will have assigned seating. We will have, when they're in line to go into cafeterias or the nurse's office, there'll be placemats on the floor for them to physically distance 6 feet apart. The student self-screening, this is what will be coming in the mail. So basically what we're asking is every day that you take a look at this or think about your student and go through this list. Fever, temperature over 100 without taking any fever-reducing medications, chills or shaking chills, cough, difficulty breathing or shortness of breath, new loss or taste of smell, sore throat, headache in combination of other symptoms, muscle aches or body aches, nausea, vomiting, or diarrhea, fatigue in combination with other symptoms, and nasal congestion or runny nose, not due to other known causes such as allergies. So I'm just going to take a minute and talk about these symptoms. What we want you to do is look at your child, and as staff too, to look at themselves. If they have a headache and a sore throat, we want you to stay home and take care of yourself. Not everything is going to be sent to the doctor for a COVID screening, but we want you to keep your immune system up and not come in with symptoms that might get worse and then put people in an alarm state. So you really do need to stay home and see if you get better. A fever, we really want you to call your physician, but headache is a common symptom of children. And even if we see headaches in school, we're not going to be sending home every student we see with a headache, but we're going to assess them and see if there's a combination of other symptoms. The most important part of this is on section 2. If you're feeling any of these symptoms, but you've had close contact with somebody who had a confirmed COVID-19 case, or if you travel to an area where there was high COVID-19 rates, then that's definitely a call that needs to be made to the physician. I'm sure there's going to be many questions about this as the school year goes on, and really please feel free to call your school nurse if you're confused about it or have any questions. The next slide refers to the new flu vaccine that just was mandated this past week. So it was mandated to all students in childcare that are 6 months or older, from preschool to kindergarten up to grade 12. This is mandated for all students, whether they are going to do hybrid or remote, if they're registered for the Mansfield Public Schools. If a student is homeschooled out of the Mansfield Public Schools, they've been homeschooled prior to this, they do not need to get the flu vaccine, but anybody who is registered with the Mansfield Public Schools is mandated to get this vaccine by December 31st. The reason why the state is pushing for this mandate is we don't want to be confused with the symptoms of the flu when we're trying to evaluate for COVID-19. We also don't want to decrease children's immunity and make them susceptible to other diseases. So it is a really important vaccine to get this year. We want to keep illness down in general, and we don't want to increase the risk of COVID-19 entering our community where our numbers are doing so well. If for some reason that you need to be exempt from this vaccine, there is a form on the Mansfield Public website, the Return to Learn website, that is a medical or religious exemption that you could fill out and fax to your school nurse. Some of the modifications that we are making to the health services and the health offices, of course, we will be maintaining 6 feet of physical distancing within the health service area. We're also going to be reaching out to parents of students who have daily medical needs in the health office during the first days that we're back at school for training. So if you haven't heard from your school nurse and you know that your child goes to the school nurse every day, don't worry, you will be hearing from your school nurse in the next few weeks, and we are going to try to make a plan for every student who will be in the school for hybrid, a safe plan for them to get what they need from the nurse. And I don't know exactly how that's going to look like, if the nurse is going to go to them, if they're going to have a meeting place, if they will distribute something at the door, or if they will be doing more sort of phone contact with the individual. But we will definitely be reaching out to you and make a plan that's acceptable to the student, to the parent, and to the nurse. One of the other things that we worked on this summer is we worked with our facilities department and with DESE and CDC and DPH regulations, and we made respiratory protection rooms for each of our schools. So if somebody does come to our school or falls ill during the day, staff or student that is suggestive of a respiratory illness that is concerning to us, we will place that person in a little health office room by themselves. We will, when they come to us and we see these symptoms, we will automatically switch out the mask, give them a clean mask, and put them in our room. Our health service department will assess that individual in PPE. We will be calling parents to come pick up their children. And we really need a quick pickup because we want to get that individual out of the school and reduce any risk of transmission in the hallways, et cetera. So we do have a plan that we will be following, and it's a safe plan. It's been approved by our health agent here in Mansfield, and the rooms are all set and ready to go. So the respiratory protection room, that's what I was just referring to. Any student who self-reports or is suspected of demonstrating symptoms of respiratory illness during the day will be referred to the school nurse for further evaluation. Again, we can only assess the symptoms. We won't identify that the person has COVID-19, but if it's a person that we suspect that, we will be dismissing them, and they need to go to the physician to either get a note for return or to get tested for COVID. They will be in that room for a short period of time by themselves, and we will follow our health office respiratory isolation plan. So I'm sure parents are wondering when and if a COVID-19 case occurs in the school systems, who is considered a close contact and how we will be tracing that and what are we going to do. So per the DPH, a close contact in the school setting is considered someone who has been within 6 feet of distance of a positive individual for at least 15 minutes in a classroom, on the bus, or in another school space while the person was infectious, or 2 days prior to symptoms or a positive test. In the elementary school, the middle school, and other school situations where students are in a self-contained classroom or a cohort, that will be the classroom. So that will be at Robinson, at JJ, and at QMS, the people that they are in their cohort with at QMS, who they travel from class to class with, and at JJ and Robinson, their classroom, that's their cohort. So if someone does become ill in that cohort, we are going to consider that cohort their close contact. In the high school, it will be a little bit different, and we will look at every case individually because we need to look at each class and where that student was. But we will certainly contact anyone who is a close contact of a positive case. Examples of close contacts: individuals who live in the same home, a teacher or students in the same cohort, students who socialize outside of school without masks. Not examples of a close contact: if you're going through the cafeteria line and the cafeteria worker has a mask on, that is not a close contact. A teacher who holds a door open for a student who will obviously have their mask on, that is not a close contact. If we have people waiting in line in the lunchroom and they're 6 feet apart, that would not be considered a close contact because it would be less than 15 minutes. So we can just go through these key actions for COVID-19 events. And we'll give you some idea of what will happen if a student or a staff is symptomatic. So if a student or staff is symptomatic at school and we send them home to get tested, we really can't move on any information until we get a positive test results back. So the student and staff, if they have some symptoms that we are concerned of and they go and get tested and they're negative, they can return back to school once they are asymptomatic, for 24 hours. And that means that their fever has improved without fever reducing medications and their symptoms have improved. If a student or staff tests positive, they need to remain home for 10 days until at least 24 hours have passed with no fever and improvements in other symptoms. They'll be contacted by the Massachusetts Community Tracing Collaborative, and they will let them know of people that were close contacts. So that's where we would come in. We will be working closely with our town's tracking initiative, and we will be contacting the people in that cohort of that positive case. If we send somebody home who's symptomatic and they decide not to get a test, and we feel that the symptoms are indicative of COVID-19, they need to stay home in isolation for 10 days from symptoms until at least 24 hours have passed with no fever and symptom and other symptoms. So basically, they're going to have to act like they had a COVID-19 test. So if a staff is exposed to somebody who is COVID-19, so this is the situation where somebody is a contact. If somebody in their classroom is positive or a teacher is positive, and we tell the whole cohort that that's a positive case, that cohort needs to stay home for 14 days after the last exposure to the person who tested positive. There's been some changes to the regulations over the past couple of weeks, and as the year continues, there's probably going to be more changes. So these forms and graphs will change. But right now, if you are a contact of somebody who's positive, even if you go and get tested and you're negative and you have no symptoms, you need to stay home for the whole 14 days to make sure that no symptoms arise. So I just want to say here, even if you are exposed to somebody who's positive and you stay home for those 14 days, our hope is that you do not turn positive, that you're just going to stay home and monitor your symptoms, because we are practicing all the safe guidelines such as mask wearing and safe social distancing and cleaning and proper hand washing and respiratory etiquette. So we're decreasing the risk of catching COVID, but we still have to have you stay home for those 14 days to make sure that there's no symptoms. So what's the next slide here? If you're exposed to somebody who is COVID-19 and you stay home for those 14 days and you begin to have symptoms and turn into a positive case, then you turn into a positive case and we have to keep you home until 10 days from the start of your symptoms. So those are the two scenarios that are going to happen, and they're going to be tricky, and there's going to be a lot of questions in the school system when this happens. But luckily, we work very closely with Chief DeRosier, and he will, and Amy Donovan-Palmer, the health agent. So we will be in constant contact, and we will work through all the questions that people have. The next slide just kind of talks about the difference between quarantine and isolation. And again, so if you're exposed to somebody who has COVID-19, you go into the quarantine category. So quarantining means that you just have to stay home for 14 days if you've had close contact with somebody who has COVID-19. You stay home, you take your temperature, you monitor your symptoms. Quarantining does not mean that you're going to get COVID, and most likely you won't. You will stay home and then you will return 14 days later. Once you catch, or once you have COVID, and you're a positive COVID case, then the term becomes isolation. That's when you stay home. You need to stay home from 10 days since this first day of your symptoms. And you really need to try to stay away from your other family members, which is very tricky to do when you have young kids and you're a parent and you'll be taking care of each other. But the recommendations are that you kind of stay in one room, that you only use one bathroom. If it's your child, you would have them use one bathroom. You would, disinfect the bathroom after their use. And that, you obviously are going to take care of them, but you need to wear a mask when you're taking care of them and near them. So those are the difference between quarantine and isolation. And it is kind of tricky because I feel like those terms get passed around all the time. I am just going to click back over here before I show the slide with all the nurses' phone numbers and fax numbers for people to use. I just wanted to see if, Justin, you have anything that you want to add to the presentation or the definitions of quarantining and isolation and what we would do if we had a positive case. I have to share your screen. Hold on. Okay. Sorry. 1 second. It's not adding. All right, Justin, can you hear me?
I think
now you're pulled up on the live stream. Sorry about that.
That's okay. I think you pretty much covered everything. And like you mentioned, we will be working closely to identify contacts in the school to make sure nothing falls through the cracks if there is an incident.
Okay. Is there anything you want to just talk about the numbers in our town or anything that you could share with the public since we have you on the spot?
Sure. So the numbers in the town remain pretty well. Total so far, the month of August, there's 15 people positive. I just wanted to point out the total number of people that have been positive since the first one in March. Out of the 198 people that are positive, only 16 were under the age of 18, which is a good number.
Yep.
That doesn't mean that's the only number of people that were positive in Mansfield. That's the tested positive. But if you kind of graph off of that, obviously the under 18 group is the lowest.
Okay. I'm just going to take a minute and just refer to the questions right now, but I'm going to hopefully pop Teresa Murphy up, Superintendent Murphy up on the screen. Yep, there you are, Mrs. Murphy.
Thank you.
I don't know if there's anything you would like to add, and I'm just going to take a minute to look at the questions on the side.
Thank you. I think it's really important that our families really understand the role that all of you as health professionals have played throughout this long summer. I know Nurse Betsy Savoy is in the background there helping you manage questions, but you are two who've been very busy during the summer helping us prepare to return to school safely, but you had much support from your colleagues. And one other piece of information that our families may not know is that during the late spring, when Chief DeRosier had a lot on his plate, he did recruit some of our RNs from our schools to help with the contact tracing in his department. And so I feel that you all come to the fall back to school with a number of skills that you developed during the spring and summer that you probably never thought you'd have to develop, but you come very well prepared to be able to take care of us in the schools. And I think that the work behind the scenes, everything from learning all of the guidelines that the Department of Education, the CDC, the Massachusetts Department of Public Health, our own Mansfield Department of Public Health have put forward, that you have worked with those, you've learned those, and our nurses are very well prepared to take good care of our students and also our staff. I think those respiratory prevention rooms are a great example. You know, that was something that I believe Mass Department of Public Health and CDC recommended very early on in the pandemic. And it was something that Christine, as our Director of Health Services, you got onto very quickly with our facilities department, with Director Matt Jacks. And you folks have blasted through some walls to be able to make those respiratory prevention rooms. So certainly between the infrastructure that has been put in place, the skills that you've developed over the course of the past months, and all of the learning that has taken place by our school nurses, I feel like we are very well positioned to be able to bring students back. Not only, because it is a time of a pandemic, but certainly as you were talking about the students who have daily medical needs in a school on just a regular school year, that you already have plans in place for working with parents and students to be able to best meet those students' needs. And so you've definitely been juggling a lot of balls, our school nurses, and I feel like we are really ready to be able to open very safely. So I think that it's important for our community to really be able to understand just how much preparation you and your colleagues as nurses have put in place, Christine. So I want to thank you, and certainly you'll be able to answer some of the questions here. And I know that there may be some questions that may show up in the chat that would be better served with a one-on-one conversation between nurse and family. But with that, I'll pass it back to you for any questions that you see.
I just want to confirm with you, because one of the questions were remote learning if a student has to quarantine. So if a student needs to stay home, because if, let's say, a cohort needs to stay home, they would switch to remote learning.
Correct. So you mean, would we continue education for students?
Yes.
Yes, definitely. And then, of course, if a child is sick, then we would be using the same, types of strategies that anytime a child has been absent from school because they are sick, certainly we would not expect them to continue their education on those days. We would help them catch up once they become better.
Right. So if a child is sick for like one day, just staying home and they're going to feel better the next day, that's considered just a regular sick day and they will catch up. But if a child, let's just say a child is a contact, so just one child has to stay home for 14 days, not the whole cohort, that child will do remote learning for 14 days.
Correct, because they're not ill.
Exactly.
Right, correct. Mm-hmm.
So they can continue learning. But if a child is homesick, ill for a day, that's a sick day and they don't have to do work, just because we have the ability to be virtual all the time. When someone's sick, they need to rest and get better.
Absolutely.
I just wanted to take a minute and say that it was a great experience working, doing the contact calling, and we did learn a lot. And I feel like we are ready to, when we come back, to help with the contact tracing, and we feel better prepared by that. And our relationship, certainly with Justin and Amy over the past couple of months, we're really comfortable with each other. So the support system is there. And what you said about Director Jax helping us with the respiratory rooms. I mean, I can't say enough about how he just really stepped up to the plate and helped us get this done, even in spite of all the other things that had to be done for school. So we really appreciate that.
And I think I'm glad you mentioned the chief, because certainly, how long were you on the job, Chief? About a day and a half before you were thrown into a pandemic?
Yeah, basically. I just wanted to mention too about what both you and Christine said. I just ran the numbers, and between myself, Christine, and the other school nurses that helped out, we talked to 117 people to do contact tracing. So 117 positive people we spoke with between the 5 of us. So the 5 of us have quite a bit of experience in the contact tracing. So I think that's going to tremendously help the nurses this school year with any incidents that pop up.
And not only with the contact tracing, but we did in the beginning, when our numbers were just starting to climb, we did daily calls with the people that were sick. So we really got a feel of the illness and how people progressed over. Some people did very well and they weren't very sick, and some people kind of waxed and waned for 2 or 3 weeks. So just talking to people every day and hearing their symptoms and how new symptoms would occur was really an education in COVID-19, and it was really invaluable. So that was, unfortunately a great experience for us, but the people, recovered and did well, which was nice too.
I think our families should also know, but I was going to say, I think our families should also know that you, the chief, serve on the COVID-19 task force, as well as Amy Donovan-Palmer, the health agent, and some others. But certainly in terms of you're not only leaders in the school system, but also as members of the town's COVID-19 task force. And one more plug for our heroes, our nurses, and that is that during the school buildings closure, nurses were also, again, thinking of the whole child and the whole family, and were also serving meals in terms of the lunch and breakfast program. So, as school nurses, you have just gone above and beyond, not only to prepare for the future, but to have also taken care of our students throughout the past months.
Thank you. Thank you very much. We do really appreciate that. And that's a different topic, but those meals will continue with the hybrid, and there'll be more information on that. One of the questions that came up was if a sibling, this is really a good question, because, we've talked about this, but if a student gets sent home sick, what happens to the siblings in the school system? The siblings in the school system can stay in school, because your sibling, this ill individual, is going home. If we are suspected COVID, they'll go and get tested. So Justin can talk about this for a minute too, but we know that there's a lot of tests being done, and there's a low rate of positive tests. So a lot of things that we suspect that are COVID, they end up not being COVID. So we wouldn't take the siblings and send them into quarantine or send them home, just like we wouldn't take a cohort and send them into quarantine without getting a positive test. So the siblings are the same, because our experience in instituting the summer program were that some people did get sick, and when they went and got tested, the tests were negative. So until that changes, until we see an increase in our cases in the town or in our situation, and we think differently, right now it's a low rate of positive tests. So we are going to be very cautious, and we're going to test a lot of individuals, and we're going to hope that those tests come back negative. So siblings can stay in the school. Justin, do you want to just chime in on that?
It's been our same experience here at the fire department. Obviously, we transport sick people every day, a lot of which have COVID, and we've sent home quite a few people that get sick during the day, and none of them have had tested positive with COVID. They all went home, they got tested, and knock on wood, none of them were positive for COVID. So like what Christine is saying, sometimes it seems like it is, but it isn't. So until we have that positive test, it's not you don't have to quarantine the whole cohort.
Oh, okay. 1 second. I don't know what that means.
I think she wants to be able to see what the rooms look like.
Oh, we just had a question that a parent wanted to see one of the isolation rooms. Honestly, they're just exam rooms. So I don't think it's, you know, we're not letting people into our buildings for tours right now because we're trying to limit, you know, individuals going through the schools and touring and that sort of thing. Even for people coming into a school, this is referring back to the daily self-symptom checklist. So we won't be having, you know, readers in the classroom this year and visitors in the classroom. We're really trying to decrease all that traffic flow. But if somebody had to come to the school, like one of the examples that I was thinking of is when we need our elevator fixed. Obviously, we need to have the elevator people come in and fix that. So we will have a symptom checklist for anybody who comes in, just as, you know, you've seen in other instances where you have to have somebody come in and fix your refrigerator or something like that. So the exam rooms are, they're actually really nice. They look great. They're just small exam rooms with doors, and that's the only person that will be in there. So, and again, questions have come up. Well, a lot of I'm on a nurse leader chat room, so we discuss a lot of different scenarios. What if you have 2 or 3 children? What are you going to do? Our plan is to have one person in that room at a time, and then it will be cleaned. If it comes to a situation where we have 2 or 3, 6 kids coming to us that we're suspecting of COVID, then that's a different conversation that we will be having. But at that point, what we would be doing is, you know, I'm assuming we've already called the parent and we're waiting for somebody or a guardian to come pick up. We would be waiting outside. The nurse would be waiting outside with that individual to be picked up. I mean, we want a quick pickup when we say we're suspecting something. So we will only have one individual in that room at a time. And a couple of questions have come across for mask wearing. So there's going to be instances where we have mask breaks instituted. They obviously can take their masks off when they eat. They'll be able to take their masks off when they're outside and they're 6 feet apart. So there will be breaks from the mask wearing. We're working on some different ideas for mask wearing and possibly instituting some, you know, rules in the school for mask wearing. But at this time, K through 1 are highly encouraged to wear masks. DESE has stated that it's grade 2 and older to wear masks. And, you know, I know that that's getting a lot of chatter. I don't, Superintendent Murphy, I don't know if you want to weigh in on that.
Well, just that we do know there's getting a lot of chatter. However, DESE had said grades 2 through 12 plus wearing masks, and but we are asking kindergarten and first graders, as you said, we're strongly encouraging that they wear the masks also. Our school committee is working on a policy, a mask policy, and so there'll be policy to align with that practice. You know, I also wanted to mention when you were talking about the respiratory prevention rooms and for example, someone wanting to see one, I think the best way to explain it is we kind of took over some offices. So for example, it could have been a speech language pathologist office. It would be a small group room that we took over and, you know, as I said, blasted through a wall to be able to open that so it's open to the nurse's office. And when Mrs. Dooling talks about there'll be one person in there at a time, for those of you who are parents of young children or any children, believe me, we will not be leaving a child sick alone, that one of our nurses will be in attendance with that child. So when we say there's one person in there, we mean one sick person, and then the nurse would be there to make sure all is well.
Yes, thank you for that clarification. That's exactly what I meant.
Mm-hmm.
And I did want to I feel like I rushed through a lot of the information in the beginning of this video, and I'm sorry about that because I too have had a long day. I dropped my daughter off at college today. Yeah. So, and then I flew here and had to figure out how to use this, but I just want you to know that I know it's nerve-wracking. I was nervous dropping her off and I had a lot of questions for her school, and, you know, you can have questions, and if we don't have the answers, we'll find out the answers, but it's going to be a safe place. We're going to follow all the guidelines, and we're going to, really make it the safest place we can for for children to return to school and for staff to return to school. The other thing I wanted to do that I really felt remiss on my school committee presentation, I really didn't get a chance to thank my Return to Learning committee. There was over 40 people on that committee. We had teachers, parents, administrators, and the parents who helped out, they were amazing. So I did want to take a minute to just thank them for all their hard work. We really looked at each school and, broke down a lot of problems that, you couldn't even see coming because, unless you work in that specific area, you don't think that that's going to be a problem. But I think it did help us for the coming year. And we've taken those small work groups and brought those questions and problems to the individual schools. And we're trying to work that to make it as safe as possible. The lunch, that was one of the questions. One of our small work groups for the Return to Learn Safely was the lunchrooms, and we really did talk at length about eating in the classroom. To be honest, I think it's safer to eat in the cafeteria. I think for food allergies, for cleaning purposes, for hand washing, for so many reasons, to leave the space that they're in and to go eat in a different space that we know is going to be properly cleaned in between people, and then return to their space in a safe manner, walking carefully through the hallways. That is the best situation that we see in our schools. So we really agonized a lot over that, and we talked about what DESE recommended. But to be honest, if you look through the new DESE recommendations, there's caveats for eating in the cafeteria, because I just think that's actually the most practical solution. So I think we've kind of covered a lot of the questions. Yep. I want to thank Superintendent Murphy and Chief Drosser, and I want to thank Betsy Savoy, who you can't see, but off the camera. So yeah, thank you very much. And I am going to, I probably should have just left this up for a while. Sorry about that. That is the individual nurses, their email addresses and their fax numbers, not their phone numbers, I'm sorry, but you can call the individual school and just ask for the nurse's office. And like I said, you can the new flu mandate is due by December 31st. You can fax the information you get for your flu vaccine to those fax numbers for the nurses. So thank you and have a good night.
Good night.
Good night.
All right.